Hi, I'm Yvonne Dietrich and we're here in Truly Bray, and I'm just going to talk a little bit in depth about 6-month braces. The system I use is CFast. 6-month braces isn't suitable for everybody. You do have to have mild to moderate crowding. Your hygiene has to be very good, which is important because they're brackets and they are harder to clean. But we'll help you with that. We'll give you the tools, we'll go through instruction with it. 6-month braces is a treatment plan to correct crowding usually, or if there's an in-standing tooth, or if there's a tooth that's kind of sticking out of a smile. We can tailor it to suit your needs, what it is that you don't like about your smile and what it is that you really want to fix. It's important to know that it's a bracket system, so the brackets are actually glued onto your teeth and then there's a wire involved. Initially, it's initial appointment with impression or a scan and photos. It gets sent to the UK, and then this is an orthodontic-led treatment. I'm not an orthodontist, but I'm a cosmetic dentist that does braces. But there's always an orthodontist in charge of the treatment. So it's a bracket system, but the brackets are set up on the teeth in a lab by an orthodontist, and then the system is sent back to me. And then the brackets are in a little tray, and we put them in the mouth, and they get glued on. And then there is which is important to know, a tooth colored wire. So there's very little metal on show at all. The wire is tooth colored, so really it's not seen. And the brackets themselves are transparent, they're see-through, and they have little gates in them where the wire sits into the bracket, and then the wire is closed. There's one on every tooth. We normally start on the first molar to the first molar on the other side. And then we only would use elastics towards the very end of the treatment to just kind of glue it all in. But there isn't the elastics that you would see normally with traditional conventional braces. You can't take it out. It's there permanently. And that suits some people because they don't have the control over it and they can't not wear it like they should do with it, which is the case in some Invisalign. If you don't wear it as long as you're supposed to wear it, it doesn't work. Whereas this, it has to stay there. You can't take it out. You do have to be careful what you eat, that you're not going to knock brackets out. But as I said, I'm not an orthodontist, so I'm a dentist who has a lot of experience in doing cosmetic orthodontics. This is a cosmetic treatment. It's not suitable for everybody. You have to be sure that you're going to have good hygiene with all orthodontic cases, but it's a cosmetic treatment. And in some cases, you're more suited to conventional braces. And conventional braces, really, they take longer. They take a year to 2 years, whereas this is 6 months. In some instances, it lasts a little bit longer than 6 months, but in most cases, it's just less than 6 months. The drawbacks with 6-month braces is that there physically are brackets on your teeth. Your hygiene has to be excellent. You do have to take care of eating certain foods because the brackets, as with all cosmetic brackets, because they're plastic and not metal brackets, they pop off. You do have to be careful with them. And as in, you can't really eat like hard pizza crusts, crusty bread, but you kind of get used to that. You know, it's not forever, it's only for a short period. I'd also be careful with things of color, like curry, things like that. As I said earlier, not everyone is suitable, and in some more extreme cases, as in people with more crooked teeth or more complex, and some cases where people have severe wear, they really are more suitable for conventional braces, and that's with an orthodontist. Also, under 18s, 6-month braces and Invisalign aren't suitable for children. They're really it's an adult treatment plan. I would tell everyone 6 to 9 months. I don't want to disappoint people. I would hate for someone, and I don't like a time frame. I'm getting married in 5 months. Can I have it done then? Some people get it done really quick. Some people's teeth move quicker than other people's teeth. And in some cases, not the case with conventional braces. Like if one arch, so say if your bottom teeth weren't very crooked, and if they're finished quicker, then we take the braces off. We don't leave them on just while we're waiting for the other arch. But most cases are 6 months and some cases are less. But I would tell everyone 6 to 9 months, just in case. 6-month braces cost €3,000 with me. Usually there's a first initial cost of €600, and that really covers our lab bill. That's where we do the impressions and the photos, and then it's another €600 to get the brackets on, and then we divide the cost over 6 months. There's also a payment plan option if you wanted to spread it out over longer than 6 months.